started the recording. I think it's clean. It's okay. So, today we are going to go straight into the blood. Now, there are several types of tissues in the body, and the blood is a typical example of connective tissue. Okay, the blood is a connective tissue, and it's not just an ordinary connective tissue. It's a fluid connective tissue. All right. So, the blood is a type of connective tissue, and it's a fluid connective tissue. Of course, it circulates around the body, and the reason why it circulates around the body is because it is being propelled by the pumping action of the heart. It is the heart that pumps the blood around the body. So, as a revision, which one is responsible for systemic circulation? Left ventricle or right ventricle? Which one is responsible for systemic circulation? Left ventricle or right ventricle?
Left.
Left ventricle. Okay. I expected you guys to have answered that very promptly, but you still took your time. But no problem. So it's the left ventricle. I've already told you that it's the left part of the heart that is responsible for systemic circulation, while the right part of the heart is responsible for pulmonary circulation. So, what are some of the things that the blood transports? It transports oxygen, nutrients, hormones, heat, antibodies, and cells of the immune system, clotting factors, and waste. Okay, so let's quickly run through the composition of blood. All right, now blood has two parts majorly. Okay, blood has the fluid. Okay, and blood has the blood cells part. So our blood can be said to be fluid and blood cells. All right, so the fluid of the blood is a clear straw colored watery fluid, and it is called plasma. So what did I say the fluid of the blood is called? The fluid of the blood is called what?
Plasma.
Yes, plasma. So plasma is the fluid of the blood. All right. So, and there are several types of. Okay, apart from this plasma, we also have the blood cells. So the blood cells are suspended in the plasma. All right. So these plasma normally constitute about 55% of blood volume, and why the cells of the blood constitute about 45% of blood volume. So if you had 55 to 45, it's going to give you 100%. So plasma is more than the blood cells. Okay. So what do we have in this? We have the plasma, like we said, which is the fluid part of the blood, and we have the blood cells. So let's see each of the blood cells. We have erythrocytes. Erythrocyte is otherwise known as the red blood cells. We have the leukocytes. Leukocyte is otherwise known as what? The white blood cell. And we have the platelets. The platelet is otherwise known as the thrombocytes. Thrombocytes. Okay. So it's important that you know these other names. Okay, if you know erythrocyte, know that erythrocyte is red blood cell. And if you know leukocytes, know that leukocyte is white blood cell. Know the other name is important. So, what are some of the disorders that affect blood cells? We have come across one of these before. A typical example is polycythemia. I think we came across polycythemia in one of our MPC past questions. So, let's first see the disorders that affect erythrocyte. Anemia. There's anemia. So, who can define anemia? Who knows what anemia is?
Red blood cell.
Excellent. So, when the red blood cells are low, then we say the patient is anemic. What of polycythemia? Who knows what polycythemia is? Polycythemia is when you have excess erythrocytes, okay, excess red blood cells. So we have the disorders that can also affect the leukocytes. The leukocytes, which are white blood cells, we have leukopenia, we have leukocytosis, and we have leukemia. Okay, leukemia more or less is a form of cancer. Leukopenia too will lead to the white blood cells being low. Then we also have hemorrhagic disease. Now, anytime you hear hemorrhage, it means bleeding. Okay, bleeding means hemorrhage. Now, hemorrhage, and what the platelets, the thrombocytes, they actually help us with blood clotting. Okay, now so Any disease that affects the thrombocyte will probably cause an hemorrhage. Okay, so thrombocytopenia is when you have low thrombocytes, and when you have low thrombocytes, okay, there will be hemorrhage, there will be bleeding. You can, if you have wound, you can start to bleed because you have low thrombocyte. Sorry, I take the leukocyte. Let me take that again. Leukopenia, okay, is when your white blood cells are low. Leukocytosis is when the white blood cells are high, while leukemia is more or less like a form of blood cancer. Now, for hemorrhagic diseases, thrombocytopenia is when your thrombocytes are low. Then also, vitamin K is very important for the formation of clotting factors. Okay, so when you have vitamin K deficiency, all right, you may also be susceptible to having hemorrhagic diseases. Please, if I'm going too fast, let me know. I'm going too fast because I need us to finish all these topics so that we can revise as many questions as possible. Now, blood component and separation. When you allow the blood to stand for a while, because the blood cells are heavier, they sink to the bottom by simple gravity. So let's go to the blood volume. The blood makes up about 7% of our body weight, and in a 70 kg man, has approximately 5.6 liters of blood. It's actually kind of lower in women, so the proportion is less in women and is greater in children. Okay, but as the child keeps growing, it gradually decreases like that. Okay, now the total blood volume in adults, we have about 80 ml per kilogram body weight in males, while in females have like 70 ml per kilogram of blood. So homeostasis, like what is homeostasis? Anybody? What is homeostasis? This time around, I'll be asking you guys a lot of questions because I realized that 84 land in Milan Atomy, so I'll be throwing a lot of questions to you guys. What is homeostasis?
Homeostasis is the regulation of the internal body temperature.
Okay, so it's not temperature alone. In fact, the answer is even here. The answer is under it. It's not temperature alone. Homeostasis is just the maintenance of a fairly constant internal body environment. That's homeostasis. Okay. And I told you that the internal environment is the extracellular fluid compartment. Okay. And the extracellular fluid compartment, a major fluid of the extracellular fluid compartment is the plasma. All right. So the blood also, by continual flow, maintains a fairly constant environment for our body cells. Okay. Now, so the internal environment actually is our extracellular fluid compartment and majorly represented by the plasma. So the blood volume and the component of the blood must be kept at within narrow limits. The concentrations must be kept within narrow limits, all right, by homeostatic process. Now, I told you in homeostasis, what we are concerned about are the components of the plasma. Take for instance, if you want to know if you are well or not, let's say a patient comes to complain to you about polyphagia, polydipsia, and poly what? What's the third one? Polyphagia, polydipsia, and polyuria. Okay, so these three, they are cardinal signs of what? These three I have mentioned: polyphagia, polydipsia, polyuria. And who knows their meanings?
Polyuria says urine.
Excellent. Polyuria says urine. How about the others?
Polydipsia, excess taste for water.
Yeah, okay. Polyphagia.
Excess,
Hunger or excessive eating. So these are cardinal signs of which disease?
diabetes.
Well, no, some people now say they are not the cardinal signs, but they are just one of the signs. Anyway, but so these are signs of diabetes. Let's say a patient comes to complain to you, and the patient complains about these signs or symptoms. If what kind of blood test are you going to run, or what kind of tests are you going to run to confirm if the patient is diabetic or not?
Urine test. Glucose.
Glucose where? In the mouth, abi in the brain or in the skin? Glucose where?
In the blood.
In the blood, yes. So you take the blood, then you check for the level of glucose. So that's why I told you that the plasma is the internal environment. Okay. So you take the patient's blood, you separate the plasma from the blood cells, and you check the level of glucose in the plasma of the patient. Okay. So that's why the blood is very important for the maintenance of homeostasis. The blood is very important because most tests we run from the blood. Okay. To check the parameter. So plasma, which is the fluid part of our blood. So what are some of the composition of plasma? Plasma is 92% water. Okay. The main constituent of plasma is water. Plasma is 92 or 90 to 92% water. Then it now contains other substances that are dissolved or suspended in it, like proteins, electrolytes, nutrients, waste products, hormones, gases. Okay. So let's talk about plasma proteins. Proteins that are in the plasma. Proteins make up about 70% of plasma, and they are responsible for the osmotic pressure of the blood. And this osmotic pressure is what keeps plasma fluid within the circulation. Now, if plasma protein levels reduces due to reduced production by the liver or loss from blood vessels, osmotic pressure reduces. And when osmotic pressure reduces, fluid shifts into the tissues, which is what we know and refer to as edema. Okay. Now, the plasma proteins are also responsible for the thickness. Okay. Viscosity is also known as thickness. So the plasma proteins are responsible for the plasma viscosity. Okay. And the major plasma proteins that are responsible for the plasma viscosity are albumin and fibrinogen. Then all plasma proteins they are formed in the liver except immunoglobulins. So please, I have mentioned three plasma proteins now. I've mentioned albumin, okay, I've mentioned fibrinogen, and I've mentioned immunoglobulins. Okay. I mentioned albumin. Albumin is a plasma protein. I mentioned immunoglobulins, and I've mentioned fibrinogen. So let's take albumin to start with. The most abundant plasma proteins is albumin, and it is about 60% of our total plasma protein. Okay. The main function, like we said albumin and fibrinogen are responsible for the osmotic pressure of the plasma. So albumin helps to maintain normal plasma osmotic pressure. Then it also acts as a carrier for molecules like free fatty acids, some drugs, and steroid hormones. Now this is very important in pharmacokinetics because if a drug binds to albumin, all right, and another drug displaces this interaction between the drug and the albumin, it may lead to some adverse drug effects. But this is still beyond your level. I cannot go into the details of the role of albumin in pharmacokinetics because it's something you will learn when you get to the pharmacy school. So let's go to globulins. Globulins are also examples of plasma proteins, and a typical example are the immunoglobulins, which constitute antibodies. I know you have heard of antibodies before. Antibodies actually interact with antigens to neutralize them. Okay, so they function more like they function more as a part of the body's immunity. Okay, they also do some work of transport. Take for instance, thyroglobulin helps in the transport of thyroxine, while transferrin, which is an example of a globulin, helps to transport iron. Okay, then some of them also inhibit proteolytic enzyme. An example is alpha 1 antitrypsin that inhibits trypsin activity. So let's talk about another type of protein, fibrinogen, which is also a plasma protein. This fibrinogen is actually a clotting factor and is the most abundant clotting factor. All right. So it is responsible for coagulation, blood coagulation. Now, the word serum, okay, and plasma are the same thing. Okay, the word serum and plasma are the same thing, but the difference between serum and plasma is that serum, fibrinogen has been removed from serum, so the serum is plasma without clotting factors. I'll take that again. Serum is supposed to be another word for plasma. The only difference is just that from serum, the clotting factor has been removed. So serum is a plasma in whose okay, but serum is plasma in which you have removed clotting factor. Okay, so there's no clotting factor in serum. There's no fibrinogen in serum, which is the most abundant clotting factor. Now, electrolyte are also in the blood. We have inorganic salts like calcium. Calcium help with muscle contraction. We have calcium, potassium, sodium. All of these three can help with transmission of nerve impulses. Then we have phosphate ion, which helps to maintain the pH, acid base balance. The pH of the blood is between 7.35 and 7.45. So to show you that the blood is slightly alkaline, and actually it's consistently undergoing this pH is being maintained by a buffering system. Okay, so we also have nutrients in the blood, in the plasma anyway. Okay, so these nutrients that we have in the plasma are end products of digestion. Take for instance, so glucose is a byproduct of what?
Carbohydrates.
Now how about amino acids?
Carbohydrates.
What?
Protein.
Protein. So okay, alright, so we, alongside the nutrient, we also have waste products. Okay, examples of waste products that we have are urea, creatinine, and uric acid. All these are examples of waste product of protein metabolism, and they are formed in the liver, carried to the kidneys for excretion. In fact, a biomarker of failing kidney will be urea and creatinine. Okay, they measure urea and creatinine in your blood. If these two are high beyond the limit, then it shows that you may be having some problem with your kidneys. Okay, so if you hear a doctor say go and do your urea creatinine, the doctor is recommending that to know the health of your kidneys. Okay, because urea creatinine are actually waste product of protein metabolism. They are although formed in the liver, but they are eliminated by the kidneys. Okay, so if your kidneys are functioning very well, they will eliminate the urea and creatinine efficiently, such that when you go for a urea and creatinine test, it is expected that your urea and creatinine test come out normal. Okay, we also have hormones. Okay, carbon dioxide is also found relatively in the plasma, is transported to the lungs for excretion. Okay, hormones are also circulating in the blood, and you know that these hormones are chemical messengers that are produced by the endocrine glands. They are secreted into the blood and transported to target tissues and all of that. So gases, let's talk about some of the gases that we have in the blood. Number one is oxygen. Okay, oxygen is not very soluble in water, less than 2%. Because of this, less than 2% is transported dissolved in the plasma. Why? Because oxygen is not very soluble in water. Now, this amount, less than 2%, is insufficient for the body's needs. Okay, so as a result of that, you need an additional oxygen transport mechanism, and this additional oxygen transport mechanism is hemoglobin. Okay, so hemoglobin in your blood helps you to transport oxygen. So oxygen is carried in the blood in association with hemoglobin. So oxygen binds to hemoglobin molecules in your blood and form oxyhemoglobin. So it is this oxyhemoglobin that now goes to all your body tissues. the body tissues and body cells take up the oxygen and free up the hemoglobin. Now, what of carbon dioxide? I'm sorry, my nostrils are blocked, so it's affecting my breathing somehow. I don't know why. Okay, so carbon dioxide also binds to hemoglobin, but not as much as oxygen. So most of the carbon dioxide in our body is converted to bicarbonate ions in red blood cells, and then they are now transported in the plasma. Now, we have talked about earlier on the types of blood cells. We said we have the erythrocytes, otherwise known as red blood cells, leukocytes, otherwise known as white cells, and platelets, otherwise known as thrombocytes. Okay, so what process forms blood? Blood cells are formed in our body by the process of hemopoiesis. Okay, hemopoiesis. Now, and most blood cells are synthesized in red bone marrow. I also explained this to you when we did the skeletal system. Okay, although some lymphocytes, which are agranulocytes, white blood cells, can be produced in the lymphoid tissues. Okay, so hemopoiesis is the process of blood formation. M means blood. Now, all blood cells, they originate from a pluripotent stem cells in the bone marrow, and they go through several developmental stages. Now, when you are a baby, okay, your red marrow fills bone space. Okay, so, but as you keep growing, that red marrow is largely being replaced by fatty yellow marrow. Now, we have two types of marrow in your bones. We have the red marrow, and we have the yellow marrow. I told you, if you check long bones, okay, in the diaphysis of long bones, what do you have there, red marrow or yellow marrow? In the diaphysis of long bones, let me quickly check you guys out. So in the diaphysis of long bones, what do you have there, yellow marrow or red marrow?
The yellow marrow, sir.
Yellow marrow. You will marry ọkùnrin ló máa fẹ́. So in the diaphysis of long bones, we have yellow marrow. Okay, but when you are probably a baby, it was not like that. Okay, so but as you keep growing, yellow marrow replaces red marrow, and you see, this yellow marrow do not have hemopoietic function. It means that the yellow marrow cannot produce blood cells, but the red marrow can produce blood cells. Okay, so and these red bone marrow are in specific places. Like I told you, in the spongy bone of the epiphysis, you can find the red marrow in the spongy bone of the epiphysis, and in flat and irregular bones. So let's continue. All these things I'm saying now will be like Greek, but it's not Greek for those of you that have been following the classes, because I already taught the skeletal system, so it's not Greek. If it's appearing like Greek to you, I have sent the videos of the skeletal system. Go and listen to it. If I were you, all those videos, I would have converted them to notes. Mati jot one because what's it called? Summary. You can use all those videos to form a note that you will quickly read. It's not that everything that you write down, you just write the key points down. You just keep reading them. I've almost completed all the anatomy topics, so there's no reason why you cannot sit down with them and form a key point, a note. It might not be more than 20 pages or 10 pages. You keep reading them. Okay, so now in adults, hemopoiesis, which is the product of blood formation, okay, is confined to flat bones, irregular bones, and ends of long bones. Okay, so what is the other name for ends of long bones? Anybody? What is the other name for ends of long bones? What is the other name for end of long bones? Epiphysis. I said I have studied today. So it's epiphysis, and the reason is because the spongy bone of the epiphysis has red marrow, and that's why the end of long bones can also form blood. So the main sites where hemopoiesis take place are the sternum, the ribs, the pelvis, and the skull bone. Now let's take red blood cell. What's another name for red blood cell?
Erythrocytes.
Erythrocyte.
Erythrocytes.
Erythrocyte. Excellent. Yeah, so another name for red blood cell is erythrocytes. Let's pray that if you see this one in exam now, you will not forget. So, the most abundant type of blood cells are the erythrocytes, and 99% of all blood cells are erythrocytes. All right. So, the structure of the erythrocyte, it is biconcave. The erythrocyte is biconcave. So, what did I say the shape of the red blood cells are like? Concave or convex?
Yeah, biconcave.
Biconcave. Excellent. Okay, so biconcave. So let's go back. They are biconcave discs, and they have no nucleus. Another way we say this is that they are anucleated. Okay, it means that they don't have nucleus. So mature red blood cells do not have nucleus. Please note this. They ask in the exam. I've seen a past question like that. That which of the following cells are anucleated? Erythrocyte is anucleated. The diameter of an average red blood cell is 7 micrometer. So what are the functions of the red blood cells? We said that the hemoglobin transports oxygen, and the hemoglobin is in the red blood cell. Okay, so the red blood cell helps to transport oxygen or gas, mainly oxygen. Now, so how is he able to do this? Number one, he's able to do this because of the biconcavity. Okay, this biconcavity increases the surface area for gas exchange. Then it has a thin central portion which allows a fast entry and exit of gases. Then they are also flexible, and this allows the oxygen to squeeze out. Now, although the erythrocyte is a cell, okay, it's a red blood cell, but it does not have any intracellular organelles. The only thing you have inside a red blood cell is hemoglobin, just hemoglobin. Who can give me examples of intracellular organelles? Give me like 5 examples of intracellular organelles. I need to be sure we know what we are doing. 5 examples of intracellular organelles. Five examples of intracellular organelles. You people, you are dulling me. Oh. Five examples of intracellular organelles.
Mitochondria.
Excellent. Mitochondria. Another one.
Golgi apparatus.
Golgi apparatus. Another one.
Nucleus.
Okay. Another one. Lórí
Lysosome.
intracellular organelles tán pọ̀. Lysosomes,
Lysosome.
ribosomes,
Ribosome.
endoplasmic reticulum.
Endoplasmic.
Why are you saying ọmọ? Kò bá ọmọ lọ now. It's simple now. Okay, so, but red blood cell, although they are cells, they do not have these intracellular organelles, and the reason is because so that there will be more room for hemoglobin. Now, also this hemoglobin is a pigment. Do you know what we call pigment? Anybody who knows what we call pigment? Pigments they are like colors. So the hemoglobin is red in color. So the reason why your red blood cells are red is because of hemoglobin. Are we on the same page? So your red blood cells
Hmm.
are red because of hemoglobin. So they do not contain any intracellular organelles. All they have inside of them are hemoglobins. Okay. So so we like to measure red cell numbers, the volume, and your hemoglobin level. Okay. Now let's continue. The lifespan of and function of erythrocyte. We have come across a question like this before, asking for the lifespan of erythrocyte. So what's the lifespan of erythrocyte?
120 days.
I was going to say, where did you see 128? So, like we said, the erythrocyte does not have any organelle, so it lacks a nucleus, obviously. Okay. Then, so what happens when an erythrocyte dies? We already told you that blood cells are formed in the red bone marrow. So the red bone marrow keep producing erythrocytes. Now the lifespan, once a red blood cell leaves the red bone marrow to the blood, it only has 120 days. Now we have, like, we said what are the most abundant blood cells?
The erythrocytes.
What?
The erythrocytes.
Yeah, the erythrocyte. So there are about 30 trillion of them, and about 1% of these 30 trillion are cleared every day and destroyed. Now, what do we call the process of blood cell formation? What do we call the process of blood cell formation?
Erythropoiesis.
No, I said blood.
Oh, sorry.
Hemopoiesis. Yes. Now, that hemopoiesis, if you now want to say the process of erythrocyte formation, it is now erythropoiesis. Okay. But you know that erythrocytes are not the only blood cells that we have. Okay. So the process of erythrocyte formation will now be called erythropoiesis. Now this process takes about 7 days for a blood cell to be formed. Okay. So, and what happens is that this process releases immature red blood cells into the bloodstream. The immature red blood cells are called reticulocytes. So what are immature red blood cells called?
Reticulocyte.
Reticulocyte. You see, these reticulocytes, they have nucleus, but they lose their nucleus when they get to the bloodstream. So they mature into erythrocytes in the bloodstream. They lose their nucleus and mature into erythrocytes in the bloodstream. Okay. So, okay, you see, mature into erythrocyte, lose their nucleus, and all of that. Now, this process of erythropoiesis, folic acid is very important, and vitamin B12 is also very important for red blood cell formation. Okay, so let's continue. Yeah, so I said that vitamin B12 and folic acid are very important for red blood cell formation, and I'll show you an example of Dr. Mayer's folic acid. Okay, so the hemoglobin. Now let's talk about the hemoglobin. We said that the red blood cell does not have any organelles, and that they are filled with hemoglobin. So what are hemoglobins? Let's talk about them. Now, hemoglobins, they are just large complex molecules, and they contain globin, okay, and a pigmented ion containing complex. So hemoglobin is a mixture of two things. We have the hem. The hem is an ion containing complex, and we have the globin. Okay, the two will come together to form hemoglobin. Now, each hemoglobin contains about 4 globin chains and 4 hem units. Okay, 4 globin, 4 hem, 4 globin, 4 hem. Now, each one has 1 atom of ion. All right. Now, each ion atom can combine with 1 oxygen molecule. So a single hemoglobin molecule can carry 4 molecules of oxygen. Okay, so we said 4 globin, 4 hem, and each one carry 1 atom of iron. So each ion can combine with 1 oxygen molecule. So a single hemoglobin molecule can carry up to 4 molecules of oxygen. Average red blood cell carry about 280 million hemoglobin molecules. You don't need this information. I just put it there because it's a part of the textbook or notes. Okay, so now ion storage. Let me see if you are going to need this. Do you need this information? But let's just talk about it. Ion is carried in the bloodstream, bound to its transport protein, otherwise known as transferrin. We mentioned this transferrin when I talked about immunoglobulin, when we talk about thyroglobulin transporting thyroxine. Okay, so normal red cell production requires a steady supply of iron. So there are 3 things now. We've talked about folic acid, vitamin B12. So iron is also important for red cell production. Now, your iron, the absorption of iron from when we eat, you know that some of the food that we eat also contain iron, but the absorption of iron from the alimentary canal is very slow. So when you take a diet that is very rich in iron, it might not still be absorbed. But a way you can improve the absorption of iron from the alimentary canal is by taking with vitamin C. Okay, so if you are taking a diet that is very rich in iron, you must also take a diet that is very rich in ascorbic acid or vitamin C. This helps the absorption of iron from the alimentary canal. That's why you see in the hospital, when iron is being prescribed to a patient, the doctor tries to add vitamin C or ascorbic acid to it. The reason is because the vitamin C helps in the with the absorption of the iron from the alimentary canal. Is this taken? So anytime you see that there's a prescription of iron and you see vitamin C, what should come to your head is that the vitamin C is being combined with the iron so that the iron will be absorbed from the alimentary canal. Okay, so note that now that iron is not readily absorbed from the alimentary canal. So excuse me, if you prescribe iron to your patient, ensure that you are prescribing other things that has vitamin C to ensure the absorption of the iron. Okay, so oxygen. Let's go to oxygen. For 1 hemoglobin, there are 4 oxygens. So when an hemoglobin has 4 oxygen, it is said to be saturated, and this hemoglobin binds reversibly to oxygen. The reason why it is reversible is because so that when the hemoglobin gets to the tissue, or the oxyhemoglobin gets to the tissue, the oxygen can dissociate from the oxyhemoglobin so that the tissue can take it up. The blood color changes with oxygen content. You know, I told you deoxygenated blood when we were taking the circulatory system, and I told you that oxygenated blood is red in color, while deoxygenated blood is cyan or bluish in color. And the reason for this is because of oxyhemoglobin. As it were, oxyhemoglobin is bright red in color. Okay, so I'm not sure you need all these ones, but let me say it. Now, what causes the release of oxygen from oxyhemoglobin? When there is low pH. Okay, metabolically active tissues like muscle, they actually release acid waste, and this causes your pH to fall. Now, under this condition, oxyhemoglobin will break down and release additional oxygen. Then also there's also low oxygen level, and that's called hypoxia. Okay, so for tissues that constantly consume oxygen, oxygen levels are always very low. So, and this increases oxygen release and all of that. Erythropoiesis. No, like I said earlier on, that there are generally the process of blood formation is called hemopoiesis. Under hemopoiesis, we have several blood cells: erythrocytes, leukocytes, thrombocytes. Now, the process of erythrocyte formation is otherwise known as erythropoiesis. Okay. Now, the general process of all the blood cell formation is known as hemopoiesis, and the process of erythropoiesis is maintained by a negative feedback mechanism. So, and the hormone that regulates this erythropoiesis is called erythropoietin. It is produced mainly by the kidneys, and that's why you see that in kidney failure or any form of renal failure, you have to place the patient on erythropoietin. If you don't place the patient on erythropoietin, the patient will be anemic, severely anemic. So one of the regular drugs, at least for acute renal failure, is erythropoietin, because the erythropoietin is mainly produced by the kidney. So since the kidney is failing, the patient needs an external source of erythropoietin. So they recommend erythropoietin. Now, erythropoietin, some athletes also use erythropoietin for doping. Doping. Now, doping means that because erythrocytes carry oxygen. Hemoglobin in erythrocyte carry oxygen. Okay, so and oxygen is very vital for energy, because the cells of your body take up this oxygen and use them to make ATP. Okay, there's oxygen, there's glucose, and your cells make ATP, adenosine triphosphate. Adenosine triphosphate is the chemical energy that your body uses to work. So we can also say that when you have more oxygen, you have more energy. More oxygen, more energy. Okay, so that's why some athletes like people that run, people that do all these things, some of them take erythropoietin to dope. Okay, so the meaning of that is that they take erythropoietin injection. This increases their red blood cells, and they can have more energy, because more red blood cells mean that you would have more oxygen and more energy. Okay, so I'm running very fast because we don't have time again, and all those topics I dropped in the group, I want us to finish every one of them without remaining one. Okay, so what are the things that stimulate the production of red blood cells? Erythropoiesis. One is hypoxia. When your body perceives that it is deficient of oxygen, okay, then it stimulates the process of erythropoiesis. No, so hypoxia. Now, and what are some of the things that can cause hypoxia? We have anemia, low blood volume, and all that. Then reduced oxygen content of inspired air. Maybe if you are at high altitude, okay, for people that climb the mountain, when you go very high in the plane, your eustachian tube opens up. Who knows what eustachian tube is? Eustachian. Yeah.
Yes.
What?
I thought you said that to be in here. I think the middle here.
Ìwọ dá o. Okay, yeah. Eustachian tube is in the hair actually. So if you travel, if you go up, you hear something in your hair like poop, and that's your eustachian tube. It will open. If you have been on a plane before, you would have experienced this. On a plane, you just hear poop in your hair. Nothing is happening. No, it's your eustachian tube that is opening up. That's why some people use maybe something like a head warmer or something to cover their ears, but it will still open up. When you are in very high altitude, your eustachian tube will open up. You now realize that you hear more because your eustachian tube has opened up. Okay, so that's one of the things that happen to you when you are in high altitude anatomically. Another thing is that when you are in high altitude, it can also stimulate erythropoiesis. Okay. Now we already established that the lifespan when red blood cells in the circulation in the blood just spends 120 days. That's the lifespan excuse me, of red blood cell, after which it becomes broken down. Okay, and the process by which red blood cell breaks down is called hemolysis. Okay, now anytime you hear lysis means breakdown. So hemolysis is the process by which the red blood cell breaks down. Now, and this hemolysis is carried out by macrophages in the spleen, bone marrow, and liver. Okay, so there was a question we answered. We said which of the following is an accessory organ of digestion, and we saw spleen there, and I told you that the spleen is not for digestion, that it breaks down red blood cell. Okay, so the spleen breaks down red blood cell, right? So it's who knows macrophages? What are macrophages? Although we still talk about them now, but I need someone to tell me what are macrophages. What type of? They are also blood cells. Do you know they are blood cells? What type of blood cells are macrophages? Now, the word phage means
White, Abby. White.
Yes, they are white blood
White
cells,
blood.
but they are formed from another white blood cell. So I need to know the name of that white blood cell that forms them?
Phagocytes.
They actually um, carry out the process of phagocytosis. It's a type of agranulocytes, and they are produced from monocytes. Monocytes, okay? They are produced from monocytes. Now, so we still talk about them. The note is inside this note. So the monocytes are monocytes in the blood, but they are okay. You see now we have two agranulocytes, monocytes and lymphocytes. So the monocytes in the blood are monocytes, but when they get to the tissues, they become macrophages. Okay, so in the blood they are monocytes. When they enter the tissue, they become macrophages. So a way to code it is monocytes, macrophages. Do you understand?
Yes,
So
sir.
monocytes in the blood are monocytes, but when they enter the body tissues, they become macrophages. All right. So a way of coding that is mm. Now, so macrophages, which are monocytes in tissues, because a question can come like that, and they will say monocytes in tissues are also called macrophages. So monocytes in the tissue or macrophages in the spleen, bone marrow, and liver breaks down the red blood cell. There's a reason why they break down. The essence is to release iron. Okay. Now, so iron is released when red blood cell breaks down and is returned to the bone marrow to form new hemoglobin. There are other things that is released from the breakdown of blood. Uh, we have biliverdin. Now, and this biliverdin is reduced to bilirubin. Now, so actually, as it were, the bilirubin is produced from hemoglobin or red blood cells. Okay. Now, bilirubin is bound to this one, transported to the liver, changed to water soluble form, and excreted in bile. Now, there's a reason why I want to talk about this. You see, if somebody has an issue with the liver, one of the ways you would see this is yellowing of the eyes, yellowing of the palm. Okay, you will see it, and the cause is bilirubin. Okay, because bilirubin is produced from the breakdown of hemoglobin, and the liver is supposed to convert it to a more water soluble form so that it can be excreted in the bile. So if these processes are compromised by liver damage, then bilirubin will accumulate in the body, and that's when you start seeing the yellowing of the eyes. Now let me bring it down to sickle cell. Why do you think you see yellowing of the eyes in a sickle cell patient? Why do you think you see yellowing of the eye in a sickle cell patient? And sometimes too, you see that in a patient who has had, maybe a child who has had untreated malaria for some weeks. You can also see the eyes becoming yellow. Who knows why? Anybody? I just want to use this as a, let's just use it to relax. So who knows why? I've painted two scenarios now. So who knows why? Okay, let me explain.
Sir,
Yeah, okay, go ahead, please.
yes, sir. I think it's because of the breaking down of the red blood cell. My concept.
How? How?
Because the when mosquito release their glands, their saliva into the gland of the body. So their main target is the red blood cell.
Okay.
Like they break down the red blood cell.
Excellent. But you get that. That's what I've been looking for. So now the plasmodium parasites actually breaks down, kills red blood cell. So when they kill red blood cell, the macrophages have to come in. Then the hemoglobin has to be broken down into biliverdin converted to bilirubin. Now, because plasmodium parasite we kill a lot of erythrocytes, that will be too much. That may be too much rather for the liver to handle. So you may see that. The same thing in sickle cell patient. Once the blood becomes sickled, it gets destroyed. Once the red blood cell becomes sickled, in fact, it's not the red blood cell. For sickle cell, we call it HBSS, hemoglobin SS. Okay. Once it becomes sickled, the blood dies and it has to be broken down, and there is high level of bilirubin. Okay. This explains. You will actually see that medicine is actually very easy once you understand physiology and anatomy. The basis of medicine is physiology and anatomy, and what makes you a good doctor or a good pharmacist is understanding the basis of anatomy and physiology. And it's not complex. It's very interesting. I don't know why you guys are finding it so complex. It's actually very interesting because it makes you relate so many things that are happening in your body together. So let's go to blood groups. Let's go to blood groups. Now, blood groups is just about antigens and antibodies that your blood contains. Now, antigens are proteins, and they are more like for identification, just to identify. Okay, so then if we have an antigen, we will always have an antibody against it. Okay. Now, so please note that we have blood group, and that's what we use the ABO system for. We use it for blood group. I am O positive, I am AB, I am A, I am B. That's blood group. Then for blood genotype, that's what we use the AS and the likes for, so that they won't bring Mike to you and say, what is your blood genotype? You say, I am O positive. That's your blood group. Okay. So now the blood group, we have the ABO system. Now if they say somebody has blood group A, that means that person has antigen A and antibody B. So let me explain to you. That means if I say somebody's blood group is A, if you give that person blood group B, that person will make antibody against blood group B. Okay. So if you say somebody is blood group B, that person has antigen B, and we make antibody against A. Now, if you say blood group A, that person has both antigen A and antigen B, and will not make antibody against A or B. So that is why blood group AB are called universal recipients, because they don't make antibodies that will fight either A or B. So blood group AB, when you do cross matching, and they can receive any blood from anybody once you have done cross matching. Are we on the same page? Now, why blood group O does not have antigen, okay, but contains antibody against A and B. So they are universal donor. They can donate because the blood does not have any antigen. All right. But O negative are the universal donor. So the universal recipient is the AB rather, like we said. AB, they are universal recipient because they don't make antibodies. Why blood group O, they are universal donor. But there's a caveat. When we say caveat means there's a but, because there are other things you also have to consider, like the rhesus factor. Is there anybody here that has O negative as the blood group? Anybody that is O negative? If you are O negative, phlebotomist will be running after you. They will always want you to come and donate your blood because you are a universal donor. Phlebotomist will want you. Mr. Victor in Fabotas, anytime he sees O negative, he's always very happy because the blood of that person is very valuable. All right. So let's make progress. Okay. Now another thing is the rhesus factor. Now the rhesus factor, when you have the rhesus antigen, you are said to be rhesus positive. If you don't have the rhesus antigen, you are rhesus negative. Okay, so that's why we say O negative are universal donor, because the whole blood does not have A or B antigen. It also does not have rhesus antigen. Okay, but it's rare to come across people that are O negative. From this note, you already see that 85% of people are positive. 85% of people are rhesus positive. Okay, so it's rare or hard to come by people who are rhesus negative. So that's why the O negative blood group is very rare. You know, I've asked you now who is O negative here, and there is nobody. Or negative at all, maybe B negative, A negative, because the rhesus negative is very rare. All right. So now, is there anybody here that is negative? Anybody? Maybe A negative, B negative, anybody? Nobody. Okay. Congratulations, because there's something I'm going to say. If you have any friend, girl, any friend, maybe girl, that is rhesus negative, that person must not abort. That person must not abort, because if that person is not a medical person, it might be difficult for that person to conceive. And the reason is because um, when you are pregnant as a rhesus negative mother and you abort, okay, maybe you are pregnant of a rhesus positive fetus, okay, if you abort that fetus, your blood becomes sensitized. Okay, so the next time you get pregnant of a rhesus positive fetus, your body will fight it and abort it. Okay, until you start taking Rogam. Okay, you may not be able to conceive and carry the baby to term. Now, and the reason is because the way they do it is that if a rhesus negative mother gets pregnant of a rhesus positive child, you give birth to that child and they give you Rogam. So your next pregnancy is going to be seamless. Now, then, but when you do abortion, they don't know if the child is rhesus positive or negative, so they don't give you Rogam. So your body is now sensitized. It will now start pushing out the baby as you are conceiving. It's pushing it out. So many people don't know the reason why they have threatened abortion, and it might be because they are rhesus negative. Do you understand my explanation, or should I take it all over again?
I understand you, sir.
Okay. So if a girl is let me make it like this: if you get married to a man and the man is rhesus negative, and you give birth to a girl that is rhesus negative, you must tell that girl to avoid abortion, because the way I've explained, if a rhesus negative girl gets pregnant and gives birth to a rhesus positive baby, they must give that woman Rogam. All right. If they don't give that woman Rogam, she might not be able to hold the next pregnancy. Okay. Rogam injection, I don't know, it's very expensive. I don't know the price, current price now. I don't know if some of you know it, but I don't know the current price now. But when I was still in the community, I think it was around 40k or something. So they must give that girl Rogam.
It's over 50k, sir. 90k.
90.
Yes.
Because I know that the last time I found it was 40k. So now, so understand my analogy now. If the rhesus negative girl now gets pregnant, okay, has a boyfriend, rhesus negative girl started dating a Pablo, okay, gets pregnant, okay, and Pablo, you have impregnated me. Oh. Pablo will now say, no, I'm not the owner of the pregnancy. Where do you want to put Israel? Where do you want to put Imole? Where do you want to put this one? Where do you want to put that one? So the girl now has no choice and goes for an abortion. Okay, because it's an abortion, they will not give the girl Rogam. They just remove the pregnancy. Now, and what this will cause is antibodies will now be so present in the blood of the girl against rhesus positive. So if the girl conceives again now, pam, of a rhesus positive fetus, that pregnancy may not use 3 months, it will come down. So the girl now keeps having threatened miscarriages, and we don't know the reason why. Okay, so I'm just teaching you because it's something you must know as a life experience and avoid such mistakes. Now you now know the rhesus factor thing. In fact, this part of the note is also showing that. So let's check it. This part of the note is saying that a rhesus negative individual can make anti-rhesus antibodies, but they are stimulated to do so only in certain circumstances. So, e.g., in pregnancy, you can make an antibody if you are rhesus positive against rhesus. Now, let's go to white blood cells. White blood cells, otherwise known as leukocytes, they are very important for defense and immune function. I think this defense should be S, defense and immunity. So what they do is that they detect foreign or abnormal antigen and they destroy it. The largest blood cells are the leukocytes. We said the most numerous blood cells, the most abundant, are the erythrocytes, but the white blood cells are the largest, but they only account for only about 1% of blood volume. Unlike erythrocytes that do not have nucleus, the white blood cells have nucleus, and some of them have granules. So the red blood cells are nucleated, but the leukocytes, they have nuclei, and some of them also have granules. Those ones that have granules are called granulocytes. Okay, while those ones that do not have granules are called agranulocytes. And it's easy to know, you don't have to cram it. Now, the granulocytes, all of them ends in phils, PHILS. So neutrophil, eosinophil, basophil, they are all granulocytes. Okay, while monocytes, lymphocytes, they are agranulocytes. Okay, so you see that the granulocytes end in phils. I'm emphasizing this because I've seen a question like that, and that's why I'm emphasizing it. The question will say, which of the following is not a granulocyte? Neutrophil, basophil, monocytes, eosinophil. So you know that all the granulocytes have phils, while the agranulocytes end in cytes. When there is an increase in white blood cells in your blood, we call this leukocytosis. Sometimes when you go for a full blood count, when your white blood cells are too high in your blood, it's a sign of something. It's a sign that either you have an infection, because the white blood cells fight infection. So when they are too high, your body will make more white blood cells. So leukocytosis is either as a result of infection, trauma, or malignancy. Now, malignancy is tumor, cancer, and all of that. So let's talk about the granulocytes. We said the process of production of red blood cell is erythropoiesis. The process of production of blood cells in general is hemopoiesis. Now, the process of production of granulocytes is granulopoiesis. Okay, so but we won't go into the details of that, but just know. So let's start taking the granulocytes one after the other. Their names, they are actually derived from the dyes that you use to stain them. That's where they derive their names from. Okay, so neutrophils. What? Yeah, somebody has a question. Jerry. Or was it? Oh, okay. Okay. Because in Google Meet, once you raise your hand, it's an indication that you have a question. All right. Okay, so neutrophils. We are taking a look at the granulocytes now. The main function of neutrophil is to protect against bacteria infection, okay, and remove dead cells, debris, and all that. So if they do a full blood count for you and your white blood cells are high, they also do differentials. They want to know which one is high. If your neutrophils are high, it's an indication that you may be having a bacteria infection. All right, so that's how to interpret that. So if a patient comes to you and say, sister nurse, please help me interpret this. What does it mean? Okay, you know that, oh, your neutrophils are high. It's an indication that you may be having a bacterial infection. Okay, so the reason why we call the neutrophil a granulocyte is because it contains granules, and the granules are lysosomes. The granules are lysosomes. So the neutrophil lives for about 6 to 9 hours in the bloodstream. Now that pus that comes out of your wound, the pus that comes out of the wound is as a result of dead tissue cells. It can also contain dead or live microorganisms, and it also contains phagocytes killed by microorganisms. So you can see that generally the content of the pus is yama yama. Now let's go to eosinophil. Now eosinophils they are capable of phagocytosis. Okay, just like the neutrophil, but they are less active than the neutrophils. Now, and they are for elimination of parasites like worms. Now, we have said neutrophils they attack bacteria. Okay, so when your white blood cells are high and they do a differential and they realize that your neutrophils are high, is an indication of probably a bacterial infection. Okay, so when your eosinophils are high, it may also be an indication that maybe you have too many parasites in your body. Now, the eosinophil also has a role in allergic inflammation, particularly of the skin, of the respiratory system. So they have an important role to play in asthmatic attacks and the likes. So they also promote tissue inflammation. They promote tissue inflammation, but they can also reduce inflammation. It's a two-way thing by releasing histamines, and histamines is a chemical that breaks down histamine. Basophils they are just basically for allergic reactions, and in their cytoplasm they contain heparin and histamine and other inflammation inflammation promoting substances. Now they are just similar to mast cells, and they can release histamine. This histamine, that mast cells also contain histamine, and histamine is an inflammatory agent. Histamine causes inflammation in your body, and in fact that's why the drugs for inflammation are called antihistamine. Some drugs for inflammation are called antihistamine because histamine release causes inflammation. Okay, so we have talked about the granulocytes. We talked about the neutrophil for bacterial infection, eosinophil for worms and inflammation, basophil majorly for inflammation and allergic reactions. So let's go to the agranulocytes, the monocytes, and the lymphocytes. These ones have large nucleus. They don't have granules like the granulocytes. Okay, so we have the monocytes. The largest of the white blood cells are the monocytes, and some of them circulate in the blood, but others move to the tissues and become macrophages, like we have said. Now both the monocytes and the macrophages produce interleukin 1. Now why are we mentioning interleukin 1? Interleukin 1 acts on the hypothalamus, and as a result of that it produces fever associated with microbial infection. Now, so this is what happens when you have an infection. The reason why you have fever is because monocytes produce interleukin 1, and interleukin 1 travels to the hypothalamus in the brain to cause fever. All right. So they also stimulate the production of some globulins by the liver. They also enhance production of activated T lymphocytes. So let's talk about the macrophages, which are monocytes in the tissue. There is really nothing much about them. Although lymphocytes circulate in the blood, but most of them are found in tissues like lymph nodes and spleen. Okay. And there are two distinct types of lymphocytes. We have the T lymphocytes and the B lymphocytes. Platelets are thrombocytes, and like we said, they are responsible for coagulation or blood clotting. So what do we need to know about this? They have no nucleus, and their cytoplasm is packed with granules containing substances that promote blood clotting. You don't need this normal blood platelet count. Thrombopoietin is a hormone from the liver, and it stimulates platelet production. It's not working. Please just. So the platelets. What are the things you need to know about the platelets? Okay, now we said, like, for the red blood cells, we have which hormone stimulates the production of the red blood cells? Which hormone stimulates the production of the red blood cell? Erythropoietin. So for thrombocytes or platelet, thrombopoietin stimulates the production of thrombocytes. Okay, and thrombopoietin is produced by the liver, unlike erythropoietin that is produced by the kidney. The lifespan of the platelet is about 8 and 11 days. I'm not sure you need all this information. The platelets that are not used in homeostasis are destroyed by macrophages, mainly in the spleen, so that you will know that the spleen is very important for any type of blood cell destruction. Then about a third of platelets are also stored within the spleen as an emergency store, and they are released to control excessive bleeding. So let's talk about hemostasis. Now, hemostasis is the process of cessation of bleeding. Now, so when a blood vessel is damaged, you start bleeding, but the blood has to stop, because if the blood does not stop, you waste a lot of blood, you become anemic, and the patient may die. So that's why the platelets are very important, because the platelet helps with blood clotting to stop bleeding. Now, the more badly damaged the blood vessel, the faster coagulation. So let's see what happens in the process of. First off, you must understand that blood coagulation or blood clotting is a positive feedback process. So, but let's see what happens. Now, what we are saying is, when you fall down like this, take for instance, and you break your skin, not your bone, your skin, the first thing you see is white. Then later you start seeing blood. That white you are seeing, they are white blood cells. They go there to fight infection. Then you start seeing blood. When you start seeing blood, your platelets must start to work so that the blood loss can be reduced. So what happens when you break your skin? The first thing that happens is that there's vasoconstriction. The platelets have to move to the damaged blood vessel and adhere to that damaged blood vessels. And not only that, they release the platelet release vasoconstrictors to constrict the blood vessel and reduce or stop the blood loss. Now, the vasoconstrictors they release are serotonin thromboxanes. These are the different things that can happen to the red blood cell. If your red blood cell, if the color is normal, we say it is normochromic. Chromic. When you hear chromic, at some point it means color. Okay. So normocytic is when your red blood cells are normal size, while microcytic is when they are smaller, and macrocytic is when your red blood cells are normal. Hypochromic is when the color is appearing pale, and all of these things. I'm not sure you need all this. Now, anemia. I think this one, I've seen questions on this before. The most common form of anemia is iron deficiency anemia, and I've explained to you the reason why iron might become deficient, because it is not readily absorbed in the alimentary tract. Okay,